Hello, hello to all the angels out there. We are bringing you a special presentation today. I have the honor of talking with the esteemed medical doctor, Mr. Darren Naugles. We are going to share with you some insights to help clear up the confusion that's been going on out there about COVID lately. What are we supposed to do? Should we wear masks? Should we not wear masks? What type of therapeutics are out there for us? How's this virus really working or spreading against us? And how many more variants are there that we could expect? In fact, I think the basic question everyone has is, when will we return to normal, right? So today we are going to stay focused a little bit on 2+ years since COVID. Now what? But before we jump into the COVID conversation, I want to tell you a little bit to introduce my very special guest. I am pleased to call him a friend, and he is a board certified emergency medicine physician and also a fellow in anti-aging medicine and functional and integrative medicine specialist in metabolic and functional medicine. And as we all know, in today's world, it is all about natural health and integrative medicine and functional medicine. I'm one, being from Jamaica, really believe in natural herbs and CBD and everything. So I really am happy to talk to Dr. Darren, because he is also the co-founder and program director for Elite Medical Associates, which is a center that offers natural and holistic approach to medicine. We're going to hear from him today because he has an advanced approach. He targets the root cause of issues and early risk factors to promote the highest expression of health in all of his patients through cutting-edge testing and personalized one-on-one appointments. So he is going to make sure you get the right amount of individual care that you so greatly deserve. He's not going to rush you in and out from the ER when you get to an ER or so forth, right? So he's going to give you the right amount of attention and make sure he gets right down to the root causes and diagnose everything. So when you leave, you are healthy and well, which is everybody's goal. All right. So he's committed to transforming healthcare with the purpose of achieving the most natural form of health and wellness for his patients. And I, being the CEO and founder of Angels On Networking, who's host many summits during the year, particularly my favorite is the Angels Health and Wellness and Fitness and Beauty Summit. So I am really big on healthy living and holistic living and natural living and staying COVID-free as much as possible and taking vaccines and preventing COVID. So with that, I thank you again, Dr. Darren, for taking time out of your busy schedule to be with us here.
First of all, I like what you said earlier. People have their whole perception of emergency medicine, and when they do come to the emergency department, what to expect. One of the things that they expect, patients do expect when they come to the emergency department, which is a false theory, is that they're going to get in and out and the doctors aren't going to be well explained to the patient about what they're here for, and that we don't take time. But I think that all changed about 2 years ago when I started to really, I've been in emergency medicine for 20 years, so I've taken care of some of the sickest people from straight out of the womb to up to 100. I like when you said that, I take my time when patients do come to the emergency department, because underlying all those medical conditions, what's the problem is their way of life. They're not eating right. Okay. They're more stressful. They don't know how to eat. They don't know how to take care of themselves. So I spend that extra 5 to 10 minutes at the end. Actually, me and the patient will break down and cry because it's very sensitive, because ignorance is amazing when it comes to patients not knowing what to do and what they're doing wrong. And to break in for a patient, look at me and say, Dr. Naugles, nobody's ever cared about that much to really sit down and tell me these are the things that I'm doing wrong in life. And then they break down and cry. And I'm a very, I try to hold my tears. That's just my heart. I have a heart to help people. And you can't, if you have a heart to help people, it's hard to hold back sometimes. I love to hear that patient say, wow, thank you. Nobody's ever done that for me.